Good evening, and thank you for joining us. I'm Alex Flood. Local kids will return to the classroom tomorrow, exactly 1 month since they were last inside of school. The long break comes with a few more safety measures in place, like improved masking and additional HEPA filters. The district's medical officer of health believes they will keep kids safer, and she offers some reassurance for nervous parents. Corey Nordstrom has more.
Dr. Janet DeMille understands the anxiety that comes with sending children back to the classroom, but is in favor of having kids return to school.
It's enviable in many ways how kids can sort of have what we think is a significant illness and they recover very quickly. That's one of the reasons why, schools are opening.
Among additional safety measures recently announced by the province, boards will have a shipment of N95 masks for all staff as part of the new measures. The Lakehead Board's Ian McRae says staff will have a new N95 mask each day, or two if they feel that's best.
We're hoping that with the improvement in masking that both students and staff will opt for a higher quality mask, and that will make a huge difference in lowering the transmission. Given that it is an aerosol transmission.
Schools have put in tremendous measures to stay as safe as possible. The school staff are very knowledgeable and will be managing various sort of situations, with symptomatic kids and things like that.
Students will still need to self-assess for COVID symptoms before each day, with the province expanding its screening list last week. Pino Tassone, the Director of Education for the Catholic Board, says they have plans in place to help students continue their education if they fail a screening or need to stay home for other reasons.
We also understand that there's, if they have to isolate, then we understand that we have to offer some form of programming. If they're off for temporarily, we will take that as if they're sick, and we'll provide them with homework, either by sending packages or we could do it through our Google platform.
Corey Nordstrom, TBT News.
And as tomorrow marks the long-awaited return to the classroom, students across the Thunder Bay area are expressing their excitement about getting back to their normal day-to-day schedules. Local students went back to online learning on January 6th, and despite the risks the Omicron variant imposes with its high transmission rate throughout Ontario, the benefits of returning to school weighed as a heavier priority for the provincial government. With the return to school now imminent, we caught up with some local students at Balsam Pit to ask them how they felt about turning off the computers and heading back through the school doors for in-person learning.
I'm really excited because sometimes online school, it hurts my eyes. So I'm really excited to go back to school and see all my friends, especially my friend Emma Anderson.
I'm excited to go back to school because I'm excited to see my friends, and online was really hard for me to learn.
I liked staying at home because I get to wake up later and I don't have to wake up as early, but I'm really excited to go back and see my friends and be in person.
I'm really scared to go back to school because of all the precautions for COVID that are going to come up, and we're going to have to separate more and more.
Well, I think it's really great to go back to school because online learning kind of sucks because it's not as good and you don't understand as much, but I'm really excited to go back to school.
I feel really happy because I get to see my friends and we can play again, and yeah.
Most of the locals we spoke to are optimistic in-person classes will last indefinitely, and although the current state of the pandemic leaves question marks, many students across the region will surely be waking up excited. A light agenda at City Hall Monday night will see council members revisit the discussion on tiny homes and the issues around partial service lots in the Niebing ward. In mid-November, Council saw a presentation on the risks that adding more lots with city water but not city sewers could pose to Lake Superior and other area waterways. City staff are currently working with the District Health Unit to review the planned development of the lots that have septic systems. Tomorrow's meeting will include a deputation from subdivision consultant Stefan Huzan, who's asking that land developers be involved in the consultation of the report to Council. In other business, Aldo Roberto is asking that Council support in principle the Tiny Homes Thunder Bay initiative. His request also wants administration to continue to work with the Tiny Homes Steering Committee and advise Council if their approval is required for any work on the file. The hospital in Fort Francis is contending with an outbreak of COVID-19 following the arrival of the virus into the facility last Saturday. It comes at the same time as another facility in the Rainy River District battles another respiratory outbreak. Adam Riley has more.
We've really been pretty aggressive in our measures, to be honest. But again, the variant has entered our facility.
On January 8th, the La Vérendrye Hospital announced it had a suspected outbreak of COVID-19, with one patient testing positive for the virus after they had been admitted into the hospital.
Were we able to track where it came from? We were not able to. But according to the standards, 2 cases would then implement that you would be in a COVID-19 outbreak if in an acute care setting, which is the case.
By Thursday, Loveday says that outbreak had grown to 5 cases, with both patients and staff affected in the hospital's inpatient unit, which houses surgical, obstetrics, pediatrics, and the ICU. Fortunately, the outbreak appears to have been contained, and while some staffing issues have arisen, it hasn't required the hospital to recall staff off sick. Loveday wants to assure the public that they can still receive care at the hospital despite the outbreak.
Don't be afraid because we're in an outbreak. We have very strict isolation and infection control practices. We've ramped up high-touch cleaning. We're doing everything we possibly can. Of course, if you don't need to come to the emergency department, probably not a good idea to come. However, if you do need medical care, you need to come.
Loveday says while it is unfortunate they're having to contend with the situation, she is happy it's the only COVID outbreak, as an outbreak announced at another Riverside facility is non-COVID related. On January 9th, a respiratory outbreak was declared at the Rainy River Health Center. As a precautionary measure, all those with symptoms were tested for COVID, and all tests have come back negative. Loveday says, like a similar respiratory outbreak at Rainy Crest Long-Term Care late last year, precautions are taken to prevent interfacility and interdepartment staffing.
So because of that, so a staff member may work here at La Vérendrye Hospital, but they also work at Rainy Crest or they work at EMO because Riverside is multi-site. So because of that, we've cohorted staff. They can only work at one site.
As to when the outbreak at La Vérendrye will be declared over is still up in the air. As Loveday says, it takes 14 days from the last known positive case. Adam Riley, TBT News.
The last several nights have been incredibly frigid in northern Ontario for those living on the streets. In Sudbury, city officials say there are roughly 15 people dealing with acute homelessness who aren't taking advantage of available services. CTV's Ian Campbell has the details.
It doesn't get much colder in the city of Sudbury than this. Those living in encampments like the one at Memorial Park doing everything they can to stay warm, using every available resource they can find.
We do have capacity for all these individuals in behind us. These are the acute homelessness people that we're dealing with at the present time that are outright refusing help from our agencies. So we do have the capacity to get them into a safe place.
Even still, Leduc says it's been a concern for him and the city, which has been checking up on, by their count, 15 people. The conditions aren't ideal or safe. Scorched evidence is all that's left of one man's belongings across the street after a fire broke out Thursday.
And nobody in the city wants to see anybody out in the cold. Council really worked well together on coming up with a plan with staff and all our agencies.
So it's very dangerous because they're trying to stay warm, doing whatever they can. And then you have the issues of fires and loss of life that way and things like that. It is a dangerous situation.
Robichaud knows a few of those living outside. She says it's an acute issue and says it's something we need to focus on as a collective city.
People are just so tired of being outside, not having the resources that they used to have, such as eating indoors.
Weather hasn't been the only challenge. Greater Sudbury Utilities shut the power off to some hydro boxes after police reported they had been tampered with.
Someone had broken the locks, pried open the doors, and connected electricity inside the cabinets. It was obviously an unsafe situation, so our crews removed the meter and capped the service, which effectively shut off the power to those boxes.
The good news was the occupant of that tent fire wasn't injured, and officials are working with him, helping him to get back to his hometown in the Niagara area. In the meantime, it's going to be another cold one for those living in the park, with temperatures forecast to drop to minus 29. Ian Campbell, CTV News, Sudbury.
Bell Let's Talk Day is coming up on January 26th, and to help recognize the cause, the campaign will be providing Lakehead University with $100,000 in grants to support the school's mental health initiatives. The funding will go towards a mental health screening program as well as increased training for members of Lakehead's campus communities, the development of a mental health dashboard, and a campus-wide anti-stigma campaign. Lakehead Student Health and Wellness Director Cheryl D'Angelo says the pandemic has caused unique challenges for students, and the support comes at an especially crucial time.
Across Ontario, students have been affected, so especially individual students who may already have been experiencing mental health challenges. We're understanding that those are worse, and now students who may not have had mental health issues in the past are now experiencing them. So the pandemic has certainly heightened mental health issues for students across Ontario.
To date, Bell Let's Talk has awarded more than $4 million in grants to post-secondary institutions across the country. Join now with Kurt Black. Kurt, this has been a wild weekend in football, hasn't it?
Crazy, and hey, I'm all for it, We saw a lot of blowouts yesterday in the first couple games, and it was a similar tone for the Eagles today, not that great, as Tom Brady and the Bucs, well, they started their journey for another Super Bowl. We'll have the highlights right after the break.